Remember you were scammed on skin cancer? Turns out sun's actually good for you. And if you don't get enough sun, you get the kind of cancer that actually kills you. And the kind of cancer you get from the sun is not as deadly. So anyway. So this is from Pierre Corey. He says, to sell statins, we were told cholesterol damages arteries. In reality, it repairs arterial injury. Yeah, it's not the cholesterol that damages your artery. It actually repairs when your artery has a rupture. Statins, which they want everybody on statins, don't prevent death and give 20% of its users muscle, liver, and nerve damage.
Job creation.
Did you know that? If you know someone on a statin, please read this. This is from Midwestern Doc Substack. So Robert F. Kennedy actually tweeted out, brave dissident doctors like Pierre Corey can help clear away the smoke of corporate profiteering so that we can see clearly the causes and solutions to the chronic disease epidemic. The great cholesterol scam and the dangers of statins. That's what this is called. Get this. So in the 1960s and 70s, a debate emerged about what causes heart disease. On one side was a guy named John Yudkin, effectively argued that sugar being added to our food by the processed food industry was the chief culprit of heart disease. On the other side was someone named Ansel Keys, who attacked Yudkin's work, argued that it was due to saturated fat and cholesterol. And now we know the rest of the story, don't we? That it's actually sugar, and fat and cholesterol aren't bad for you. But let's read on.
Wait, it says a case can also be made mass adoption of vegetable oils.
A case can also be made that the mass adoption of vegetable oil leads to this increase in heart disease. Well, that's what we were just talking about, seed oils. Ansel Keys won this debate. The guy who said it was fat and cholesterol. Yudkin, the guy who said it was sugar, he was largely dismissed, and Keys became the nutritional dogma.
What are they, the president of fucking, if something causes heart, are they the president of that? Why are two guys debate the end all be all?
Let's read on, Kurt. A large part of Key's victory was based on his study of 7 countries. He studied Italy, Greece, former Yugoslavia, Netherlands, Finland, America, and Japan, which showed that as saturated fat consumption increased, heart disease increased in a linear fashion. So there was that correlation. They made it into causation. However, what many don't know, and as this study is still frequently cited, is that this result was simply a product of the country that guy chose. If that guy would have chose different countries like Finland, Israel, Netherlands, Germany, Switzerland, France, and Sweden, the opposite would have been found. So he just chose the countries that aligned with his hypothesis. If he would have chose those countries, it wouldn't have showed up.
What? Another one of these stories? This is the story of every single thing.
So fortunately, Kurt, it gradually became recognized that Ansel Keys did not accurately report the data he used to substantiate his arguments in the first effing place. For example, recently an unpublished 56-month randomized study of 9,423 adults living in state mental hospitals or a nursing home, which made it possible to rigidly control their diets, that Keys was the lead investigator on, was unearthed. So this guy Keys did this study of 9,423 people in hospitals, and the study inconveniently found that replacing half of the animals, meaning saturated fats, they ate with vegetable oil, meaning corn oil, it lowered their cholesterol. So if you replace the saturated fat with corn oil, it lowers your cholesterol. But get this. And for every 30 points that their cholesterol dropped, their risk of death increased by 22%. So lowering your cholesterol, according to this, doesn't make you less likely to die. which roughly translates to 1% drop in cholesterol, raising the risk of death by 1%. So for roughly every 1% you drop your cholesterol, it raises your risk of death by 1%. So what I'm hearing, what this is saying, I'm not saying it, what this is saying is that this study that was never published says that lowering your cholesterol is actually bad for you.
Oh, well, thank God they take their time with vaccines and really do a thorough job, because this is scary.
Likewise, recently, one of the most prestigious medical journals in the world published internal sugar industry documents. They showed the sugar industry had used bribes.
What?
To make scientists place the blame for heart disease on fat so Youngkin's work would not threaten the sugar industry. You're kidding. Scientists are just as corrupt as every other motherfucker in any other place in the world? Yes.
But I view them as the clergy of our rational modern society.
They are not. So, in turn, it is now generally accepted that Youngkin was right. But nonetheless, our medical guidelines are still largely based on Key's work, saying that fat and cholesterol are the culprits. However, despite a significant amount of data that now shows lowering cholesterol is not associated with a reduction in heart disease, the need to lower cholesterol is still a dogma within cardiology. I had a doctor try to get me on statins to lower my cholesterol. I refused it. Before I read this article, I knew what to stay away from statins. For example, how many of you have heard of the 1986 study which was published in The Lancet, which concluded during 10 years of follow-up from December 1st, 1986 to October 1st, 1996, a total of 642 participants died. For each 1 mmol increase in total cholesterol corresponded to a 15% decrease in. So if you increase the cholesterol, it decreased the risk in mortality.
Wow, they knew this a long time ago, huh?
They knew this in 1996.
Well, it's good I'm hearing it now. I've never watched my cholesterol, so I guess I did good with that.
By the way, let me tell you something. I've been eating 3-4 tablespoons of butter for breakfast since, 1999. And I don't watch any of my fat or anything. And I had my heart checked with echocardiograms and CTs, and after my vaccine injury, and my cardiologist said you have 0 blockage. 0. So do you know why I don't eat a lot of sugar? One of the consistent patterns I've observed within medicine is that once a drug is identified that can beneficially change a number, meaning change the number of your cholesterol or your blood pressure, that medical practice guidelines will gradually shift to prioritizing treating that number, and before long, rationales will be created that require more and more of the population to be subject to that regimen. In the case of statins, Kurt, prior to their discovery, it was difficult to reliably lower cholesterol, but once they hit the market, statins, research rapidly emerged stating that cholesterol was more and more dangerous, and hence the more and more people needed to be on statins. So once statins hit the market, they went out and created these studies that said cholesterol is really dangerous and you got to lower it because we found a drug that lowers it.
Do you remember what's her name from Three's Company that had the Thigh Master? I saw Larry King talking about
Suzanne
statins.
Summers.
You're like, yeah, statins are good. And she was talking about blood pressure with him on
As you would
right around that time.
As you would expect, similar increases also occurred in the United States. For example, in 2008-2009, 12% of Americans over 40 reported taking a statin, whereas in 2018-2019, that number had increased to 35% of Americans are taking statins. Just in 10 years. Given how much these drugs are used, it then raises a simple question. Well, how much benefit do they produce? Well, I
got to see their books at the pharmaceutical company.
Hold on to your balls. As it turns out, this is remarkably difficult to question, to answer. Why? Because they keep the data hidden, Kurt.
Proprietary.
Because the published studies use a variety of confusing metrics to obfuscate their data. Nonetheless, when independent researchers looked at the published trials, which almost certainly inflated the benefit of statin therapy, they found that taking a statin daily for 5 years resulted in you living, on average, 3 to 4 days longer.
What? How can I not be on it?
Sadder still, larger trials have found this minuscule benefit is only seen in men.
Not women?
In short, most of the benefit from statins is from creative ways to rearrange data and the cause of death, not any actual benefit.
This sounds like misinformation.
In circumstances like these, where an unsafe and ineffective but highly lucrative drug may be sold, the next step is typically to pay everyone off to promote it. I wonder, did that happen during COVID? I don't know.
No.
For example, to quote Chapter 7 of Doctoring Data, the National Cholesterol Education Program has been tasked by the National Institutes of Health to develop guidelines that everyone uses for treating cholesterol levels. Excluding the chair, who was by law prohibited from having financial conflicts of interest, the other 8 members, on average, were on the payroll of 6 statin manufacturers. In 2004, the NCEP reviewed 5 large statin trials and recommended aggressive LDL lowering for high-risk patients, primary prevention with lifestyle changes, and statins. Well, if 6 of the 8 members were all on the payroll, if 8 of the members were on the payroll of 6 statin manufacturers, In 2005, a Canadian division of the Cochrane collaboration, who were not paid off, reviewed 5 large statin trials. 3 were the same as NCEP's, while the other 2 had also reached a positive conclusion for statin therapy. That assessment instead concluded statins have not been shown to provide an overall health benefit in primary prevention trials.
Oh my God, we gotta pay those guys off.
That's
made a terrible mistake. We have to pay these guys immediately.
So get this, the American College of Cardiology then made a calculator to determine your risk of developing a heart attack or stroke in the next 10 years based on your age, blood pressure, cholesterol level, and your smoking status. In turn, I've lost track of how many doctors I saw proudly punch their patients' numbers into that calculator and then inform them that they were at a high risk of stroke or heart attack and urgently needed to start statins. Given that almost everyone ended up being high risk, everyone needs a statin.
And you qualify for TRT.
I was not surprised to learn that in 2016, Kaiser completed an extensive study which determined this calculator overestimated the rate of these events by 600%. Sadly, that has not at all deterred the use of this calculator. For example, medical students are still tested on it for their board examinations.
Wow. Tom Cruise is less crazy than people that trusted their doctor.
That's right. Presently, we believe cholesterol somehow gets into a blood vessel and then damages it, leaving an atherosclerotic plaque. Kendrick, this other doctor, in turn argued that a competing model that the medical professionals largely buried provides a much better explanation of the actual cause of heart disease. So that's what we think now, that cholesterol gets into your blood vessel and then damages it. But here is the new theory, or the theory they've known for a while. Blood vessels get damaged. The body repairs those damage with clots. As clots heal, they are pulled inside the blood vessel wall, and a new layer of endothelium, which is blood vessel lining, grows over that clot. As this occurs multiple times in the same area, the damage, or the plaques, under the blood vessel becomes more abnormal. In short, a good case can be made that our entire heart disease model is based on a variety of correlations that were erroneously assumed to demonstrate causation.
Was your clue when they said somehow it damages and that was the only explanation?
Yes. Sadly, while the correlation is not causation mantra is frequently used to dismiss anything which challenges the orthodoxy, you will frequently find overtly false correlations that support the medical industry's bottom line by being treated as unquestionable dogmas. So they use that term correlation is not causation to dismiss something that doesn't go along with the establishment orthodoxy, but when you can use it to dismiss something that is the establishment orthodoxy, they ignore it. Okay.
Yeah, well, remember that guy who said maybe we should wash our hands before we stick them inside of people for operations?
Yeah,
that doctor,
that's right.
I think he ended up in an insane asylum or something.
So this is what they make you think is happening inside your arteries, that it just gets clogged with cholesterol. That's what they make you think is happening. Well, what's actually happening is you get an injury from your blood vessel has an injury, like a burst or something. So then it sends cholesterol there to fix it. So then there's a clot, and then the inside of it grows over. And when that leaves, it leaves cholesterol behind because it fixed something. So that's totally different. What they tell you is cholesterol gets there and hurts you. No, cholesterol's there to fix something. And then there's this is the headline on this part, is called the statin damage crisis. My primary issue with statins is not the fact that we waste billions of dollars each year on a useless therapy, approximately $25 billion per year in America alone, but rather it's the fact that they have a very high rate of injury. For example, the existing studies find between 5 and 30% rate of injuries. And Dr. Malhotra, who I've had on this show, the leading cardiologist from the UK, having gone through all the existing evidence, estimates that 20% of statin users are injured by the statins.
That's worse than cocaine. That's worse than cocaine.
I can't vouch for the veracity of what Kurt just said. Likewise, statins are well known for having a high percentage of patients who discontinue their drugs due to the side effects. For example, one large study found that 44.7% of older adults discontinue the statins within a year of starting them, while another large study of adults of all ages found 47% discontinued within a year. So here's Dr. C. Malhotra. He tweets out this video of himself. He says the lack of transparency in the prescription of cholesterol-lowering statin drugs in relation to side effects is a public health scandal. There are solutions to making medicine great again. So here it is.
Can I stop you for a second?
Yes.
Is it because those side effects, fatigue, muscle soreness, things like that, were fairly mild? Is that why they were underreported?
Great question. So now we know the reason. So first and foremost, when I ask a patient complains about side effects, I ask them, is this interfering with your quality of life? So if they say yes, by definition, from their perspective, it's not mild. It's something that's really just making them feel pretty, pardon my language, shitty. But the reason, Joe, that they were not reported, and that came out later on, this is something I didn't know as a medical student, as a qualified doctor, as a specialist, is until then, is a lot of the clinical trials that are conducted that drive guidelines, these randomized trials where you give patients, one group gets the statin and one group gets a dummy pill, and they don't know whether they're getting the dummy pill or the statin, and then they're followed up and you see whether they have less heart attacks and what side effects they get, is that there's something called the pre-randomization run-in period. So before the trial actually starts, people are enrolled, and then if you get side effects, you are taken out of the trial before it starts. So what happens is, So what happens is the end result of those trials is therefore biased towards people who didn't get side effects.
Who's running this, Mr. Beast?
No shit. Here's another one. You really couldn't make up how the University of Oxford was making money from both sides of the statins controversy. Here we go.
You really couldn't make this up. 2016. So he's campaigning saying side effects almost non-existent. I get a phone call from the Sunday Times journalist, a guy called John Ngo Thomas, great guy. And he said, Asim, won't believe what I found out. Because the reason this came out in 2016, they decided to republish. So what Colin said, he says, there's a lot of discussion about statins and side effects. So we're going to reanalyze our own data again. and look into this. So they published this piece in The Lancet in 2016, and they basically said the same thing again. Side effect statins are rare, less than 1% maybe get, some mild muscle aches, that kind of thing. A week later, this journalist calls me, and he says, I found something really interesting. What is it? He said, in the United States, there is a genetic test called Statin Smart, which is the company, Boston Heart Diagnostics is a company that is marketing this, has a license to market this product. And on their website, the genetic test, the co-inventor of this genetic test is Professor Rory Collins. And on their website, they're selling this test to basically try and figure out who's likely to get side effects. So you do this test and it tells you whether or not you're likely to get side effects from specific statins or not. And it says 29% of all statin users are likely to get significant muscle symptoms or side effects from statins.
Whoa.
And he did a Freedom of Information request to Oxford University. I published on this with John Abramson, actually. We did this in one of the paper we wrote later on. And Oxford University came back and basically said that he asked them, how much money have you taken from selling this device? And it was something in the order of, the university had received £300,000, and Professor Collins's department had received about £100,000. It doesn't make any sense. So in one sense, he's saying side effects are non-existent. Yeah, he's co-invented a test to try and detect who's likely to get side effects. And on the website, it got taken down after that, interestingly. We published it and we highlighted this. But it's like, hold on, they're kind of making money from both sides here. And for me, it just highlighted, this was all really, for me, like a symptom of a system failure where, there are all these concealed conflicts of interest. People are being selective with the information they put out. And ultimately, at the root of the problem, Joe, is that these big, powerful pharmaceutical companies, these corporations have more and more control and unchecked power over these institutions. There are conflicts of interest, but people don't know about it, right?
Yeah, it doesn't make any sense that it only costs $100,000 for them to do this. That's what don't make sense.
I know.
All the other parts make sense. $100,000, that's all it takes for you to kill people?
So here's what
mass murder is $100,000.
So the cause of statin side effects. So statin, there's this thing called acetyl and whatever the pathway. So it blocks this. The statin comes in and it blocks it here. And so then all this other stuff that it's supposed to do, it doesn't get done. And so one of those things that you don't have because of a statin is this thing called CoQ10, which turns out is really important. And if you don't have it, it has bad side effects. Some of the common energy-related side effects of statin CoQ10 deficiency. So if you take statins, it blocks this chain of events, and then you don't have these CoQ10s. And here's what happens when you don't have the you get mitochondrial damage. You get lack of energy. Mitochondrial damage. You get lack of energy, chronic fatigue syndrome, congestive heart failure, and fluid retention. You get shortness of breath. You get gout. Some of the side effects of statin CoQ10 deficiency weakening the cell wall integrity include hepatitis.
What?
Yes. Pancreatitis.
Nice.
Another thing I can't pronounce, but it has something to do with skeletal muscle tissue.
Rhabdomyolysis?
And tendon ligament inflammation and rupture.
Wait, Jimmy, how many people quit after taking statins? Did it say 47%?
I think almost 45%.
Okay, so I'm going to go out on an even further limb and die on this hill that also cocaine, that is not the case.
So this is the place that is the compromised center that does all the studies on statins, right? It says the cholesterol treatment trial is collaboration. So they're incentivized to say it's bad and statins are good. And here's what I went to their website, and this is what they actually say. Updates, March 2024. This is their update. Yeah, statins can cause a small increase in blood sugar levels, so people at high risk may develop diabetes sooner.
Well, that sounds inevitable.
So remember, this is the place that's in bed with them. This is on their front page.
Well, Jimmy, wait, I like that they're making a test to see if you're going to get side effects from it. So that way they can give it, people could just take it for no reason and hopefully we'll just get these side effects.
Right. So here in August of 2022, a new study shows muscle pain is not due to statins in over 90% of those taking the treatment. Now, do you see how they phrase that? It's not causing muscle pain in over 90%. So you know what that means? Here's another way you could say that. Statins cause muscle pain in 10% of the people who take them.
Oh, the glass is half full. They're saying,
That's
Jimmy.
another way you could say, yeah, it turns out it does cause muscle pain. Turns out it does. That's
10%?
another way of saying that.
By the way, I'll bet it's more than 10%.
I would bet too. In July 2022, a large review of statin clinical trial data could soon end remaining uncertainty on possible statin side effects.
Oh, I bet it won't.
This is from the pro people.
It says collaboration on the goddamn
Says
page.
it right on it. So many statin victims say they abruptly, almost in the blink of an eye, they have become old people when they started taking statins. Duane Groveline, MD, was started on a statin and has soon developed global amnesia,
What?
which is really scary. Just amnesia. He decided to stop the statin and he recovered. He's lost his memory. When I suggested on the basis of my 23 years as a family doctor that perhaps my new medicine was the cause of my amnesia, the neurologist replied almost scoffingly that statins don't do that. He and many other physicians and pharmacists were adamant that this does not occur.
Were they all counting a big fat wad of cash while they said it to you?
Just like when I went to the neurologist, when I had my occipital neuralgia, which I got from the vaccine damage, and I went to a neurologist, and I go, yeah, I got an occipital neuralgia from the, he goes, you didn't get that from that. That didn't come from the vaccine. He just said it like that. And at the same time, my producer at the time had the same thing. Steph had the same thing. And you get it on the same side that you got the vaccine. I got the vaccine on this side because I got a flu shot on this side. It's like 6 years ago. Still hurts.